The measures of meaningful use are categorized into two groups. One that measures the use of actual EHR technology, and the other one that measures the clinical quality of the system. Quality measures include efficient measure systems for heart failure, pneumonia, stroke, and surgical care in a hospital setting, and diabetes care, weight management, and asthma care in the ambulatory setting. The proposed Stage 1 criteria for meaningful use will focus on electronically capturing this health information in a coded format and using that information to track key clinical conditions and be able to communicate that information for coordination of care purposes and initiate all of the reporting for clinical quality measures and public health information. The proposed criteria are based on a series of specific objectives, each which is tied to a proposed measure that all eligible providers and hospitals must meet in order to demonstrate that they are meaningful users of certified technology. For the physician, the CMS incentive program includes three foundational cornerstones: meaningful use, interoperability, and reporting quality measures. For the physicians, reporting quality measures are accomplished by satisfying the CQM, or Clinical Quality Measure, core objectives. Physicians previously participating in any PQRI program from CMS will recognize many similarities between PQRI and the clinical quality measures. The quality measures follow a similar format and in many cases are identical to existing measurements. As with PQRI, the clinical quality measures consist of a denominator which defines the population of patients eligible for the quality measure, and a numerator which defines the quality action for each patient. Some ask very simple questions like, what number of diabetic patients do you have with an hemoglobin A1C less than 8%? Or others are more complex, like, did a patient with prostate cancer at low risk for reoccurrence and treated with one of the 4 specific regimens have a bone scan at any time during their treatment for prostate cancer? The one principal difference between PQRI and the EHR incentive CQM objectives is the patient population under study. With PQRI, this is limited to the physician's Medicare Part B patients. But with the CMS EHR incentive program, the population the physician will provide or will report on to CMS includes all corners of their practice, every eligible patient seen during the reporting period, regardless of their payer status. The framework for reporting the clinical quality measures are unique. There are a total of 44 CQMs available for reporting, and each physician is expected to report 6 of the individual CQMs in order to meet the core meaningful use objective. 3 of these measures must be the core clinical quality measures, and 3 must be measures from a CQM menu of 38. Within this framework, the program does provide the physician with some flexibility when selecting which CQMs they would care to report.